Alrighty, guys. I'll continue on with some more thoughts from Tumortown for you. Bruce here, of course. I'm going to follow up on the video about why American healthcare is so expensive and things we can, and now I'm going to do things we can do to make it cheaper or control the cost, at least, if nothing else. So, first thing, and what I'm projecting, what I'm proposing, of course, would not be popular with the healthcare industry at all. I mean, period. They would hate it, But if we were really willing as a nation to stand up and do the things that we need to do, then this is what I would suggest we do without altering the system the way it is right now, really, at all, in any major way, in my mind. So first off, I would nationalize healthcare. I would get rid of all of the individual state rules and regulations, and I would put in place one set of national rules and regulations that insurance providers and healthcare providers have to meet in order to operate and do business in the United States of America. Period. National system. Right? So now when I buy a health insurance plan from United Healthcare, it's good with me wherever I go. I don't ever have to change it if I don't want to. I can move to Hawaii and it's still good there. I can go to D.C. and it's good there. I can do whatever I want. Go wherever I want within the United States, and that healthcare plan is in effect and functional. Right? Doesn't matter. Now, in so doing, I have done a second thing, as you might have noticed. I have eradicated networks, right? Doctor-provided networks or insurance networks, where doctors provide an insurance company with a, increased discount on their rate for the fact that, they can provide that service. Right? They're a silver medal provider, whatever, You know what I'm talking about. So now you have networks, but they're national networks, right? So if you're a, silver network provider in Tennessee and you're one in California, then I can see either one of you, right? Doesn't matter which, right? No matter what, I can see you. So now we've gotten rid of that whole bureaucracy of people that are involved in, keeping in line with all the various state rules and regs for each individual insurance company and healthcare provider. We've just gotten rid of that. Okay? And we've allowed healthcare providers now to become regional and national. Right? And that they would like because, I can expand now. I can buy hospitals in the state next to me. Woo! Expand my network. Woo! They're going to like that. Right? So, so that's number one. Then number two is I would nationalize the rate structure for providers. Much like it is with Medicare. It's one system that's designed for the entire nation. Now, granted, there would be geographic differences in what a healthcare provider gets paid for their services, right? Because it costs you more to deliver services in downtown Manhattan in New York City than it does in Boise, Idaho. Right? It does. So, okay, that guy in Manhattan is going to get a little more money for what he does than the guy in Boise, but that's just because that's, necessary to balance the thing off from a cost value standpoint, right? So, because if I paid the guy in Boise what I paid the guy in New York, now he's making a killing. And that guy's going, hey, So there would be, fluctuations in what providers got paid on geographic bases. but it would be a fixed thing that would be done by industry professionals and lay people, in a sense, bean counters, whatever, would sort all this out. They would put it in place, and then they would continue to tweak it over time, right? But everybody would get the same. Now, this does a couple of things. This creates a level playing field across the nation. So now the insurance companies, from their point of view, no longer care about market share, because market share doesn't matter. They're going to pay the same to the providers no matter what their market share is. So now an insurance guy who wants to get into the business actually could. You could have a startup who could get into it and go after it with a different type of customer service model, whatever it was they wanted to try, because now it didn't matter market share. They could simply go in there and give it a whack. So you open it up, and now you have actually created competition within the insurance marketplace rather than no competition, which is pretty much what you have now. And I think that would be a good thing. You might find some very interesting ideas out there on how insurance companies could impact the healthcare system overall. And you would also have a national claims system. So everybody operated off the very same claims system. So nobody was different, so you didn't need a whole bunch of people, Mary for that insurance company, Bob for that one, this one, that one, that one. No, you didn't. You just need a couple people, to do your claims, because everybody's operating off the same claim structure. So we've done that in a national sense. And then, of course, you don't need that whole bureaucracy of people between the insurance companies and the providers negotiating prices. They're gone. Out the door. Don't need them anymore. The healthcare industry needs, people badly. So I'm sure all those folks could find work in the healthcare industry if they'd like to, right? Becoming nurses, technicians, you name it. So I don't see that as like, oh my gosh, we're making a whole group of people unemployed. I don't see it that way. I think there's plenty of opportunity for those folks to reemploy themselves, and we would make all sorts of things available to them to go back into the healthcare industry, except within it as actual providers, if the insurance company can't find something for them internally. Right, so we just basically nationalize the system. That's all we do. Right, so all the insurance companies are still intact. They're still working, and they still have the ability to make money. Right, the providers are still there. They're doing their thing. They still have their way. They're making money. So everybody's still doing their thing. It's just now my insurance plan is portable. It goes with me wherever I want to go, pretty much. And I don't have to think about whether or not a provider network is there for me if I go somewhere else, and what that's going to cost me and how bad that's going to hit me. Right? So the only other thing really you could start to do would be to look at the policies themselves and see if there are any other things in the way policies are set up that you might want to change. But that just making those things, national rather than state-based, I think would go a long way to making things much more manageable and much more competitive in terms of a level playing field. And if you think the idea of, price setting nationally for providers is crazy, Pennsylvania actually does this for hospitals within the state of Pennsylvania. The state dictates what hospitals charge for their services in the state of Pennsylvania. And they have done this for a very long time. And it works quite well for them. So it's not really that strange of an idea when you get right down to it. So that's kind of where I would go without mucking with the system really badly. And, think about it, come up with your own ideas. And I don't know that we'll ever get a chance to bring those ideas to the fore and ever make them potentially a reality. You know, that would be a real hard fight, but at least the idea is out there. And we know that there is possibilities if we really want to, or if our kids really want to work together and put the pressure on to make those things happen and make those changes that would benefit them greatly in the way the system works and the way it would cost them in the future. All right, thanks guys. Peace and hang ten.